State put COVID-19 infected patients into nursing homes? It sounds too crazy to believe, but let's ABC7 Coronavirus News. New York Governor Cuomo criticized over highest nursing home death. From the article, they are second-guessing a state directive that requires nursing homes to take on new patients infected with COVID-19. In order, they say, accelerated outbreaks in facilities that are prime breeding grounds for infectious diseases. You think? The way this has been handled by the state is totally irresponsible, negligent, and stupid, said Elaine Mazzotta, a nurse whose mother died last month of suspected COVID-19 at a Long Island nursing home. They knew better. They shouldn't have sent these people into nursing homes. Why were they sending COVID-19 infected patients into nursing homes? If this was Donald Trump or a Republican, it would be all over the news every single day for the next month. But because it's beloved Governor Cuomo, they just brush over it. Let's also keep in mind that New York State has the most coronavirus deaths and patients by far. And they had a directive to put infected COVID-19 people into nursing homes who we know are the most at risk of dying and getting infected. It's absolutely insane, disgusting, and ridiculous, but partisan politics will ensure that people just won't seem to care about this.
In Washington Heights, Isabella Geriatric Center looms over a nearby park. It's a massive 705-bed nursing home. When we visited last week, black tarps were hanging over one parking lot entrance, hiding what was in the back of the facility. Only residents could look down and see it clearly. It's a refrigerated trailer for bodies, only found by New York One through a metal fence at the adjacent building. That's not the only thing the nursing home is trying to hide.
They didn't even test my mother. So April 1st, when we got in touch with them, we asked them, was she tested for COVID? Does she have COVID? You saying she's not going to make it, she's very sick. And they said, we're not doing tests. The social worker, Karen Hoffa, said, we're not doing tests in Isabella, only at the hospital. And that's why we're sending them to the hospital.
Adrienne Blackett died at Isabella on April 6th. She was 68 years old. The cause of death was COVID-19. We spoke to her daughter, Melody Jenkins.
She takes the phone in there. I hear my mother. She sounds horrible. Barely could talk without gasping for air. Coughing. It's crazy how fast it took place. You understand what I'm saying?
Yeah.
It took, the sickness took, it just got her so fast from 4 days prior.
According to the state, as of Wednesday, only 13 people have died at this Washington Heights nursing home from COVID-19. But that number is deceiving. The death is much, much higher. At least 98 residents of Isabella have died since the pandemic started. They either tested positive for COVID or were suspected to have the virus. They died on site, at the home, or at a nearby hospital. It's almost 14% of the residents. These numbers have not been disclosed by the state or Isabella until now. The number of deaths at Isabella far exceeds the reported numbers of any other nursing home in the entire state. In mid-April, Isabella admitted to a growing death count. In a message on its website, it gave the official count it gave to the state, but it went on to say at least 19 people died in the hospital, too. It said another 37 deaths at Isabella and one at the hospital were suspected to be from the coronavirus. The facility has since deleted that paragraph from the website. In response to this story, a spokesperson for Isabella said each death is heartbreaking and its staff is grieving.
Of nursing homes as deaths in elder care facilities mount amid the COVID-19 epidemic.
Nursing homes, they are our top priority. They have been from day one.
Governor Andrew Cuomo announced the investigation Thursday and said he would take action along with State Attorney General Letitia James.
They have to notify residents and family members within 24 hours if any resident tests positive for COVID or if any resident suffers a COVID-related death.
The State Health Department only recently released data about nursing home deaths after intense public pressure. and some families have told horror stories of not being notified by nursing homes about their loved ones' conditions or even deaths.
The nursing home is responsible for providing appropriate care. If they cannot provide that care, then they have to transfer the person to another facility.
A nursing aide at one nursing home, the Villages of Orleans and Albion, contacted 7 Eyewitness News saying, "No staff in that facility has the proper PPE. Please help before the nursing home gets wiped out." The aide said she quit her job just days ago after she said officials tried to get her to move from a COVID unit to a non-COVID unit. She said she was, quote, "not going to continue to put that nursing home at risk with no proper PPE and the constant cross-contamination." The Villages is rated 1 out of 5 stars by the state, the lowest possible rating, and state records show it was fined $10,000 2 years ago for, quote, multiple deficiencies.
I want to circle back to Mr. Cuomo. Mr. Cuomo, you put out a policy on March 25th. Nursing home administrators, directors of nursing, and hospital discharge planners. Despite the fact that we had enough data to know that frail senior citizens in nursing homes, in assisted living homes, and senior facilities are the #1 potential death target of this virus. You sent coronavirus positive individuals into nursing homes, and now you're blaming the nursing homes. Here it is. Here's your order right here. It says no resident shall be denied readmission or admission to the nursing home solely based on a confirmed or suspected diagnosis of COVID-19. Nursing homes, listen, America, are prohibited from requiring a hospitalized resident who is determined medically stable to be tested for COVID-19 prior to admission or readmission. The next day, the nursing homes and their association begged the governor, please don't do this. We can't handle these people. We have senior, frail residents in here. And what does he say? He doesn't care. In fact, the title in the Wall Street Journal that day was, New York mandates nursing homes take COVID-19 patients. What kind of an idiot do you have to be to take COVID-19 positive patients out of hospitals and put them with frail senior citizens in nursing homes? They're not set up for that. That guy, honestly, has blood on his hands and a big mouth to boot. Now, the Florida governor, he says, hey, the data shows nursing homes are a problem. Assisted living homes are a problem. What does he do? He moves his medical resources into those areas to try and protect
Uber, Lyft, going through the whole process, and you can see behind me, they have the testing facility, and they can come.